The East Daily Download is sponsored this week by the following.
Hi, I'm Dr. Valneni. I am a family medicine physician and a diabetologist at James D. Bernstein Medical Center. I have been working for almost 5 years as a family medicine physician, and I went back to do diabetes fellowship for a year in ECU and came back just in August. A diabetologist is a medical provider who is specialized in diabetes. A diabetologist diagnoses, manages, evaluates and treats all forms of diabetes, including type 1, latent autoimmune diabetes, all other forms of diabetes. Since November is Diabetes Awareness Month, I would like to talk to you a little bit about diabetes, nutrition and activity today. The most important thing when a patient is worried about is medicine, but actually you can control diabetes with diet and physical activity itself. There are a lot of myths about diet these days. Like people think if I eat fruits, if I don't have to eat baked food, I can eat baked food, I can eat fruits, and then that is good for my diabetes. But actually, there are a lot of fruits out there that are rich in sugars that will raise your blood sugar. Passion fruits, grapes, bananas are loaded with sugars. If you're eating them, you have to be very careful that it does raise your blood sugars, and you should avoid them as much as possible. The fruits like apples, oranges, those are good for you. Those have minimal carbohydrates, at least less carbohydrates than the other fruits we talked about. Those are the fruits I would go for when you have diabetes. There are superfoods, nuts, cheese stick. These are the snacks you can choose if you want to when you're eating in between meals, because they have less carbohydrates and loaded with protein and fiber and superoxidants in them, which will also manage your diabetes better. Now coming to physical activity, American Diabetes Association and American Heart Association has recommended 30 minutes of moderate brisk walking or moderate activity daily, 5 days a week, or 150 minutes per week. This will regularize your diabetes more than anything. So I recommend you to walk 30 minutes every day or distribute your 150 minutes as you want to distribute it, but making it a habit will help you, because it really takes 6 weeks to 8 weeks for you to form a habit. And if you need a family medicine physician or a diabetologist, reach out to me at Bernstein Medical Center. You have a great day.
The East Daily Download is sponsored this week by the following.